So my name's Philip Besson. I'm doing a lumbar spine examination today as part of the postgraduate diploma in sports medicine module 5. Mick's kindly volunteered to help us out today. So ideally I'd like to focus my examination on patient demographics, on a history of symptoms. We've not got that today, so we're just going to go through a general lumbar spine examination. So just before we start, quick question to you, Mick. Any pain in your lower back, hips or knees today?
Nope.
Brilliant. So we're going to start off just by having a look at you walking, if that's okay, Mick.
Yep.
So what I want you to do is just take a few paces forwards, just up the room, turn around on the spot, a couple of paces back. Okay, so I'm just assessing gait there, looking for a normal heel-toe strike, looking for any asymmetry, and looking for any Trendelenburg gait, any antalgic gait, or any signs of foot drop which may suggest a nerve lesion. Okay. In a similar fashion then, Mick, I want you to just again take a couple of paces forward, but this time I want you to try and do it just on your heels, if that's okay. So this is a general screening test, really good for peripheral nerve and spinal nerve lesions. The heel strike can determine whether there's any L4, L5 pathology. Again, in a similar way, on your tiptoes, a couple of steps forwards and back for me. Again, a good general screening test for any L5, S1 nerve root pathology there. Okay, so grand. If you can just take a step forwards for me, mate, that's brilliant. So my assessment then goes on to an inspection of the back and lumbar spine. So first of all, I'm looking at any shoulder asymmetry and level of shoulders, looking for a good muscle bulk and noting any scoliosis that may be obvious, looking at the level of the iliac crests, and again there's no asymmetry there, which is really reassuring, and a good muscle bulk in the gluteals. From the side, I'm looking for a cervical lordosis, a normal thoracic kyphosis, and a lumbar lordosis, loss of which may indicate sort of a posterior pelvic tilt or a flat back syndrome. Okay, what I want you to do, Mick, if it's okay, is just turn and face the wall for me. Are you able to shuffle forwards ever so slightly? Good. So then we're going to go on to palpation and having a feel of the back. So again, I'm feeling the large muscle bulks for any tenderness which may suggest a muscular pathology. I'm having a feel down the spinal processes, noting each one and noting any steps in the spinal processes, or again any spinal tenderness. Okay, and having a feel over the sacroiliac joints for any tenderness specifically in that area. Everything okay with that? No pain? No problem. Good. Well, so after palpating, I'm then going to go on to look at some of the movements of the back. Okay, so just turn to the side for me, Mick. That's brilliant. So first action then is flexion. So what I want you to do is just bend forwards for me, reach down as far as you can go, and back up for me. Grand. So we're looking for a normal lumbar flexion. Okay. Any previously noted scoliosis, if that corrects during flexion, that can suggest more of a functional scoliosis rather than a true scoliosis. The next one I want you to do, Mick, is just lean back, push your bum back forwards. That's grand, and straight back up. Brilliant. So that's an assessment of lumbar spine extension, and then we're going to do lateral flexion as well. So what I want you to do is just slide your hand down your leg for me. That's brilliant. And back up again, and the other side. Good. So there's normal and equal lateral flexion in that position. Okay. In screening for the kinetic chain, we also need to look at the joints above and below. So one thing I want you to do, Mick, is just cross your arms across the front of your chest and just keep your pelvis nice and still, but just turn to the side as far as you can, and just fixing the pelvis in that position, just to assess for thoracic rotation there. and we'll go on to screen the hips briefly in just a second. Okay, that's grand. So we then go on to do some of the special tests of the lumbar spine. First of all, we're going to do Chauvet's test, which is a measure of lumbar spine flexion. Okay, so I've got my tape measure here. Can you just turn and face the wall for me, just so I can show the camera what I'm doing? So I'm having a palpation of the posterior superior iliac spines. We'll go 5 centimetres down from that. Where are we? There we go. And I'm going to mark that on the back. Okay. What I want you to do then, Mick, is just bend forwards for me. Okay. And 10 centimetres above the posterior superior iliac spine, I'm looking for a further extension of plus 5 centimetres to indicate a normal lumbar spine flexion, and that's grand. That's seen normally there. Grand. So that's Chauvet's test. Again, sorry Mick, we'll just turn around to face the camera for me. We're then going to do a stalk test, a useful test to screen for any sacroiliac joint dysfunction. So what I want you to do is, when I say, is just raise your leg for me and just hold it there for a couple of seconds. So I'm palpating the posterior superior iliac spines, and either side I'm feeling for the second sacral bone. And can you bend forwards for me? Ground and back, and just lift your leg up. Okay, that's great. And as Mick lifts his leg there, I'm looking for the ipsilateral drop of the posterior superior iliac spine. That's grand, so that's completely normal. Okay. Again, in a similar fashion, I want to do a leg extension test, so I want you to bring that leg up and lean back for me. So do you want to do that for me, mate? So again, a hyperextension test with the leg extended. Back up. Sorry, they're a bit wobbly. So that's a really useful screening test, especially in the younger teenage athletes, for any spondylolysis, which would cause a localised pain to the lower back. Okay. So the next thing I want to do is get you up on the couch, if that's okay. So if you just have a quick lie on your back for me. That's great. So we're going to start off with a quick screening test of the hip, just to make sure there's no obvious hip pathology, and then we'll go on to do a couple of other special tests. So Mick, can you bring your leg up for me, bend your knee, and I'm just going to gently turn that outwards, turn that inwards. Good. So he's got good internal external rotation of the hip and good flexion. So we're going to go on to do the Thomas's test to assess for any fixed flexion deformities, to assess for any iliopsoas tightness, which we may see associated with cross-pelvic syndrome. So what I want you to do, Mick, is again just bring this knee up for me, nice and straight. Okay, and back down again. And it might be easier on the other side, so you bring this knee up for me, and I'm just looking for the contralateral leg lifting off the couch. There's no obvious fixed flexion deformity there, so we'll leg back down again. Good. So Thomas's test negative. Brill. So in a similar fashion, Mick, just bring your leg up. I just want you to turn it and just rest your leg. That's it. So we can again screen for sacroiliac joint dysfunction or pain just by pressure onto the contralateral anterior superior iliac spine and the knee to stress the SIJ for any discomfort. That's okay. Brill. We then go on to consider a little bit about the neurology and any radiculopathy of the lower legs for a nerve root problem. So Mick, what I want you to do is just keep your leg nice and straight, just raise that up for me as you can. Good. The straight leg raise. That's fine. Good. And back down again. Good screening test for any sciatic nerve root impingement and would cause exacerbation of symptoms through that point. We can make that a little bit more sensitive. Again, if you just raise your leg for me, and we're just going to pull your foot back. Okay, so again, stretching that sciatic nerve. Any pain or irritation during that would suggest nerve root impingement. Okay. In a similar way, we could do the slump test. I'm not going to go into that today because we haven't got time, but I'd get Mick to perch on the edge of the bed in a similar fashion, raise the leg, but also flex forward and flex the neck to really stretch on those nerves. Okay. So Mick, the next thing I want you to do, if it's okay, is just turn over onto your front. So looking for any higher up nerve impingement lesions, we can do in a similar fashion a femoral stretch test. So I just want you to bend this leg up for me, okay, and bend your knee for me, and raising that up. Any tightness or pain can suggest tightness of the quadriceps muscles, or higher femoral nerve, sort of L1, L2 impingement. Grand. And back onto your back if that's okay, mate. So as we come towards the end of the test, I'm then going to go on to test the neurological status of the lower legs, power, reflexes, sensation, yeah, so let's go on and do that. So can you bring your knee up for me? Okay, and I want you to just stop me pulling down. Okay, so that's, any weakness would indicate L2 lesion. And I want you to push away with your foot. Good. So knee extension, L3. I want you to bring your foot back for me. That's good. And just rest your leg down. You may as well do it that way. Grand. And so any L4 lesions. I just want you to try and hold your big toe up now, just like Mark does. Okay, so pulling down on that again would indicate a L5 weakness. And push down for me, and S1 nice and strong. Okay, so good power throughout is lower lumbar myotones there. We can then check reflexes. So just relax your leg for me, Mick. We're just going to do the knee jerk. Granted, you've got a good reflex there, and just bring your heel up. That's good. And just relax your foot for me, and we're just going to do a simple ankle jerk reflex there. Brilliant. That's great. We then assess for sensation. Doing that very crudely today, but can you feel me touching you both sides there, Nick? Yeah. And both sides. Similar both sides? Okay. So we go through the dermatomes. So L2, L3, L3, L4, L5, S1. Okay. So you've had normal sensation throughout your lower limbs, and right thinking. That's grand. So that's great. That concludes my assessment of the lower limbs today. Obviously, if I'd indicated any pathology in some of those screening tests, I'd focus a little bit more specifically on that. But I wanted to get through the general examination today. And Mick's passed with flying colours, so thank you very much, Mick.
Thank you.